Hello, my name is Abigail Cole. I'm one of the anaesthetic doctors working here at BHRUT. Today I'm going to talk to you about anaesthesia on the labour ward. The anaesthetic team are involved in two main aspects of a woman's care on the labour ward. Firstly, by helping to provide pain relief when in labour, and secondly, when providing an anaesthetic for a caesarean section or other procedure to help deliver the baby. First, we will talk about the pain relief options provided by the anaesthetist. I'm sure you'll be aware that there are multiple pain management options to you when you're in labour, and your midwife will be able to talk to you about gas and air and pethidine and when these may be administered. Epidurals and spinal anaesthetics are the most effective forms of pain relief. They are both placed in your back to allow pain relief to be placed around the nerves. A spinal is a single dose of medication which will last around 2 hours, and an epidural is an injection which allows a thin plastic tube to be left in place, so repeated doses of pain relief can be given. A spinal injection is used most commonly in theatre for a caesarean section, and an epidural is used most commonly to help with labour pain. On some occasions, a combination of the two of these may be used, and these are all collectively known as regional anaesthetic. Preparation before an epidural includes setting up a monitor for the baby's heart rate and placing a thin plastic tube placed into your hand for fluids, and this is called a cannula. Epidurals are not instant. They can take 20 minutes to set up and a further 20 minutes for the pain relief to start to kick in. Your midwife will help you get into the best position, and this is to sit forward, curling your back, or lie down and curling your back on the side. This position is very important and is demonstrated here. Cold spray will be applied to your back, and the anaesthetist will then inject local anaesthetic to the skin, which will sting initially but then go numb. It's really important to try to keep still whilst the epidural is being sited. The anaesthetist will try to work with you, and if you start to have a contraction, then please tell them and they will stop until the contraction is over. When the anaesthetist is placing the epidural needle, you will feel pushing or pressure in your back, but it should not feel painful. If you feel any tingling in your back or bottom or legs, then it's nothing to worry about, but please let your anaesthetist know. Once the epidural is in the correct place, the needle will be taken out, but the epidural catheter will be left in situ. This is then used to deliver your pain relief medication at regular intervals. Once the epidural is in, your blood pressure will be taken regularly, and you will have a catheter placed by your midwife once you are comfortable, as you will not be able to feel when you need to pass urine. If you have a raised body mass index, then the epidural may be more difficult and take a little longer to place. 1 in 10 epidurals sometimes don't work well enough, and these can be repeated or combined with a spinal anaesthetic. Common complications of the epidural are that it can drop your blood pressure, cause you to feel a little bit sick or itchy. These things are all relatively easy to treat. 1 in 100 epidurals can cause a severe headache. Very rarely they can cause problems with nerve damage, paralysis, infection and blood clots. And these are all very rare. Backache is common in pregnancy and is unlikely to be caused by the epidural. We will now move on to talk about the anaesthetic options if you go to theatre. If you go to theatre, then the epidural discussed a moment ago can be used. If it is not working well enough, a spinal injection will be placed, and this is inserted in the same way as an epidural, only it is a single injection rather than leaving a plastic tube in your back. On some rare occasions, it will be in your baby's best interest to have a general anaesthetic. This may be because the baby needs to be delivered very quickly and there is not enough time to wait for the spinal or the epidural to work. Or it may be because there is a medical reason where you're not suitable for a regional anaesthetic, for example, previous spinal surgery, brain problems, or blood clotting issues. In this case, a general anaesthetic where you'll be put to sleep will be used. If you have a general anaesthetic, you will have monitoring applied to check on your heart rate, blood pressure, and oxygen levels. You'll be given a liquid to drink before you go to sleep, which will neutralise any stomach acid. You will have an oxygen mask placed over your face, and the anaesthetic medications will be placed in a drip in your arm. You'll be asleep within 10 seconds, and at this point the surgery will begin. You will be asleep within 10 seconds, and at this point the surgery will begin. We would always recommend that it is safer to have an injection rather than a general anaesthetic, as they let you and your partner share in the birth, and you will feel less sleepy afterwards. They will let you feed and hold your baby as early as possible, and you will usually have good pain relief afterwards. Your baby will usually be more alert when it is born, and you will have less post-operative nausea and vomiting. Thank you for listening to our video on anaesthesia on the labour ward.